Sarah, can you confirm if we've started recording yet?
Yes, the recording has started.
Okay, awesome. Sorry, I usually get a notification and it didn't tell me this time. So welcome everyone. Thank you while you're introducing yourselves in the chat. Welcome to our Rural Café. My name is Victoria Freer. For those who don't know me, I'm a senior program analyst here at NACCHO for rural health. Today's Rural Café is going to be on grant application and funding strategies. So we're very happy to have you guys here. Welcome, and I will go ahead and turn it over to Amber Hubert from the Deloitte team.
Thanks so much, Victoria. Thank you guys for joining today's session. For today, we aim to understand grant application and funding strategies through promising practices and practical approaches. As a group, we will aim to foster effective problem solving and information sharing. We hope to understand strategies local health departments can use to prepare grant applications, and we'll compile a list of grant application and funding strategy promising practices following the session. We will share out the recording of today's session, as well as the slide deck and a summary of today's topics discussed today. To quickly go over the agenda, I will introduce who's joined our call today, along with our presenters. We will overview the grant life cycle from the perspective of the awarding agency and awardees. We will discuss how we can stay on mission while securing funding. We will share grant application promising practices and some considerations. And to discuss funding strategies as an example, we will discuss opioid settlement funds. And then we'll open up the discussion to ask our presenters any questions that you have regarding the content shared today. And then before we wrap up, we'll ask you to complete our follow-up survey following the discussion to share how the session went for you today. So now I'll turn it over to our lovely presenters, now I'll discuss who's on the call for today. We have our lovely health department representatives who make up a majority of today's call. We also have our NACCHO and Deloitte teams who are helping to facilitate today's discussion. And then we may have our CDC Office of Rural Health representatives join our call today to hear valuable insights that they may share back with their colleagues. And I'll turn it over now to our lovely presenters for today, Sarah and Julie. Sarah, I'll have you go first, introducing yourself.
Great. Good afternoon, good morning, depending on where you are. My name is Sarah Hezzy. I'm a senior manager with Deloitte, and I have spent more than a decade working with Department of Health and Human Services as a granting agency, really focus on how they can improve their processes, their financial assistance mechanisms to have the biggest programmatic impact in the field. I'm really excited to be here with you all today to share the perspectives of the grantors, what kind of goes on behind the scenes, and then discuss promising practices for how you all can make sure that as you are looking to secure funding, are looking towards that sustainability of your funding, what is it that the granting agency or the grantors are really expecting and looking for? So thank you all for having me.
Great, thank you so much, Sarah. And we'll have Julie introduce herself during her section of the presentation. So we'll move along. I do want to quickly go over the rules of the road. We do ask that you be present and in the moment during the session and actively participate. Feel free to continue to enter comments in the chat, as well as coming off mute if you have a question during the Q&A or want to discuss anything at that section. And feel free to come on video with us as well to actively engage with us. This is an open forum, so everyone's input is valuable. No one is expected to know all the answers on the call, and we can definitely learn from each other here today. It's important for us to build on ideas and be positive, using phrases like yes and rather than no but. We do ask that everyone go beyond business as usual and challenge conventions and norms. Let's think about solutions as well and be creative with the approaches that we come up with today. And always assume positive intent and give others the benefit of the doubt. So feel free to ask clarifying questions if you're unsure of anything discussed here today. And of course, if there's anything else which you'd like to share, continue to enter it in the chat as well. So we'll move on to an icebreaker. We'd love to kick off our conversation today with a lovely icebreaker. We'll have Sarah kind of launch the poll for us in Zoom today. We would love to know which of the following types of funding does your local health department receive? Is it federal funding, state funding, NGO funding, all of the above? And if other is an option, please select other and feel free to enter in the chat other types of funding that your local health department receives. We'd love to hear from you today. Great, we have a lot of responses coming in, so let's keep it coming. A few more minutes. Right, let's go ahead. Some more coming in. All right, Sarah, let's go ahead and see the poll results. Great. So looks like it's quite a few people who are receiving funding from all of the above, both federal, state, and NGO funding. So it's great to see, and well, we're excited to kind of jump into the topic today. So I'll go ahead and turn it over to Sarah to discuss the content for today.
Great. Thank you so much, Amber. I think we can just go to the next slide and dive right in. So we're going to start by talking about the overarching just life cycle of a grant. And really, to help ground ourselves in the topic, we want to just make a kind of quick distinction between grants and cooperative agreements. Throughout the rest of the presentation, we're going to be using the term grant and really talking about some of these concepts interchangeably, but it is important to recognize the difference between the two types of mechanisms. So in a grant, the federal government or the other awarding agency provides oversight and monitoring, but is not directly involved in the project, does not have a sort of substantive role to play. In a cooperative agreement, however, there is a substantive role for the awarding agency that typically shows up in things like technical assistance or training, and can even be, really around that capacity building. So kind of a way to think about the distinction between the two are grants are funding that is kind of provided and intended to execute those activities under the award without the expectation or the need for substantive involvement by the awarding agency, whereas a cooperative agreement does have that substantive involvement. And I think cooperative agreements are also a great way to kind of build capacity and really have reach back to subject matter experts or even other, grantees and other awardees who might be going through similar challenges or doing similar types of work. All right, next slide. Now, within types of grants, and again, going to use grants, but really this applies to grants and cooperative agreements, there are two kind of prominent types: discretionary and non-discretionary. Really, the kind of core difference here is in how the funding is allocated and really the expectations for how much autonomy, let's say, that the awarding agency has in selecting who will be awarded that funding, what projects will be funded, and sort of what the terms and conditions of those funds will be. So with discretionary grants, those can also be considered, they're typically competitive grants. Sometimes they're called project or program grants. And those are really things where a program or the awarding agency is able to define, what are those activities that we would like to see our grantees, our awardees carry out. We will be, competing for different pots of money, and depending on the applications we get back in, we will make determinations about who should be funded and at what level. For non-discretionary grants, those are where the funding is authorized through a statute and really requires a specific sort of, whether it's a formula or other, like-to-like comparison of what that funding will look like. Non-discretionary grants, these are things like block grants, entitlement programs, etc. Some that you might be familiar with include, the SNAP program, WIC funding, things like that. And again, the really core difference there is that legislation really defines how those funds will be distributed with a non-discretionary grant, whereas with a discretionary grant, the program, the awarding agency has far more flexibility in terms of what they are awarding and the activities that they might be awarding.
At 44720, what's it?
Next slide, please.
Yeah, so we'd love to know what types of grants your health department is receiving. What type of discretionary funding or competitive grants does your health department receive? Feel free to enter it in the chat. Bill says state grant for car seats, yes. I know some people might be receiving a current grant through the NACCHO team as well. HRSA. Yep, the NACCHO grant, tobacco cessation, MRC, strong, community foundation, car seat grants. It's great. Thanks so much for sharing. Continue to enter it in the chat. I'm sure others would love to know what types of grant you're receiving as well.
Yeah, and it's great to see the variety that you all are describing, and I think can really appreciate the complexities sometimes of this funding, given all of the sources and the differing things that you can use the funding for.
We'd also love to know what types of non-discretionary funding or block grants your health department is receiving. Yep, WIC and family planning. I'm sure a lot of people are receiving similar block grants. HIV.
Mm-hmm.
Right, thanks so much. Yep, some more coming in. State disparity grant funded by CDC for COVID-19. Maternal child health block grants. Yep. Yeah, keep them coming. And we'll go ahead and move along. Okay. Turn it back over to you, Sarah.
Great to see all of that variety, and just to provide for those of you who have not spent as much time as I have in the federal grant environment, just a little bit more around some of those key players, and really just to help understand, how funding goes from, a president's budget or the executive branch all the way down to you all with your health departments. So the executive branch and the Office of the President does propose that initial budget that then is sent to Congress. That executive budget really is just about that administration's priorities. I think an important thing to note, it's not binding. There tends to be a lot of conversation and sort of policy debate that comes about with that budget. But really, it's just a blueprint, if you will, for the president's and the administration's vision for funding and for programs. Congress is the one then that actually, builds the budget. They have the power of the purse. They are the ones who actually does the appropriation of funding to the varying agencies, to the varying programs. They authorize, that statutory, non-discretionary funding, as well as providing funding that can be used for discretionary programs. Then those appropriations are kind of passed through the Office of Management and Budget. They're the ones who actually do the apportionment. So Congress has said, here is your pot of money that you as an agency, as a department have. Here is what maybe your individual offices or programs have. And then OMB is the one who actually apportions that money to those agencies and programs. And that's where you get to the awarding agency. I saw in the chat that many of you, it seems, are receiving funds from multiple awarding agencies, even under just the Department of Health and Human Services. And some of you might even be receiving funding from other federal entities. And so that's really where, you know, that individual awarding agency, not just as the department, but as HRSA or SAMHSA or CDC, they are the ones that then are actually doing the obligation, disbursement, and kind of the accounting of that funds. And then you all as the recipient obviously are expending the funding and meeting the terms and conditions of the award and reporting back up, you know, what you have done with that money and the impact that it's had. Next slide. I talked about this a little bit, but again, just to kind of provide a little bit more color to the process of how funding is made available. So that initial budget is proposed and sent to Congress. And again, as kind of noted here on the slide, you know, that president's budget is not binding. It has no sort of weight, cannot be acted upon. It is a great way to kind of understand administration priorities and potentially even, you know, plan or look ahead and think about, okay, we can see that this administration is, you know, I'm just using an example, maybe very interested in building capacity for early you know, maternal and child health. Maybe we could expect that there might be additional funding for some of those priorities when funds are actually appropriated, but there's nothing binding in that initial legislation or in that initial proposal. All of the programs are then authorized by Congress, and some of these, again, for those block grants or for those non-discretionary programs, the actual kind of pot of money and what those funds can be used for and how they can be dispersed is all prescribed with the legislation. With discretionary programs, Congress instead says things like, you know, whether it's as an office or as an overarching program, here is your apportionment or here is your kind of overall funding for the year. But with those discretionary funds, programs are able to make choices about what they might want to fund. Are there sort of innovation strategies that they're interested in pursuing? You know, might there be kind of new and novel ideas? And then finally, all of those appropriations, again, do have to be done by Congress. And so a grant program cannot obligate funding until its budget has been appropriated by an act of Congress and then apportioned by OMB. For those of us who have been operating in this environment for the past several years and frankly for a long time, if you think about how there continue to be things like continuing resolutions and, you know, kind of piecemeal funding throughout the year by Congress. If you've ever run into a situation in which you have had funding and, you know, your awarding agency isn't able to guarantee that there will be funding the next year, or they say, you know, we're not quite sure what that level is going to look like, the reason for that really comes back to Congress holding the power of the purse and that therefore the awarding agencies genuinely not knowing what their final portion of the budget will look like. And so if you all have ever experienced that frustration or that confusion, please know that from the awarding agency perspective, they also feel that, and they want, you know, they want to continue funding these programs. They want to continue funding the work that you all are doing and the impact that you're having. And they're really hamstrung by kind of Congress and Congress actually passing those budgets. All right, next slide, please. Now, the overarching grant life cycle is very simple and also very complex. So we're going to talk about the very simple version. In the pre-award phase, that is where a program is deciding, you know, what is it that we want to fund? How do we want to structure that funding? What are those activities? What are those performance measures? What are those terms and conditions that we'd like to do with this funding? That also has the application review phase where, you know, a NOFO or a notice of funding opportunity or a funding opportunity announcement, a FOA. To be clear, those terms are used interchangeably. It really just depends. They mean the same thing. They're going to look like the same documents. It really is just a legacy of certain divisions, certain awarding agencies using one term or the other. They're analogous. Once those go out, the applications are actually able to be, you know, kind of sent out to all of you. you're able to respond to them. And then we move into the awarding phase. That's when award decisions are made, notifications are given, NOAs are released, and we'll have slides that kind of go into some of these details further. And that basically just lets you all know how much funding you'll receive, what the terms and conditions are, and what the expectations are for reporting. And then the post-award phase is the longest phase of any of this. That is really the implementation. What does it look like to use this funding? What is the reporting requirements? And then at a certain point in time, what's that closeout? Right, next slide, please. So I talked a little bit about kind of broad strokes what happens here, but just going to give a little bit more detail. So again, based on legislation and the budgets, that is where the awarding agency prepares and publishes that NOFO or FOA. They will then put those and make them publicly available so that it is kind of a clear and open opportunity, especially for those discretionary funds. And typically applicants will have 30 to 60 days to actually respond to those applications. 60 days is considered the kind of standard amount of time, particularly for federal grants. However, there are opportunities that sometimes might be a 30-day or even a tighter turnaround, and some that might be a 90-day. But 60 is typically what you'd be looking at. Once those applications come in, the awarding agency is reviewing them for completeness, really assessing what those programmatic substances of the application, what all have you said that you are going to do with the funding, what is the impact you intend to have, how will you be using it? And they do that kind of financial review along with the activity review. And then they make those final determinations around decisions and announcement. So as applicants during that same phase, and this again would be during that 30, 60, 90 days that you have to put together your application, you'd be consulting with your staff to determine if that funding opportunity aligns with your mission and goals, consulting with your finance department around how can we use this funding? Do we have the right systems in place to track it in accordance with regulation? Do we have the staff that would actually be able to execute with these funds and, perform against the terms and conditions? And then finally, you all will be developing and submitting that proposal that meets all of the requirements that are listed in the FOA or NOFO. Next slide, please. During the award phase, and again, this is typically a very, very short phase, but the awarding agency would send a formal, notice of award. That notice of award is the official legally binding issuance of the award that contains all of the final terms and conditions, all of the final budget numbers, and all of the approved activities to be done under that award. What's really important is that during that award phase, you all as grantees or awardees, you would receive that formal notification, but then you would have an opportunity to review that NOA, ask any questions, maybe even potentially enter into some negotiation if there was confusion or misunderstanding or a misalignment in expectations. Because once you sign and return the NOA, that does become the legally binding document between you all and the awarding agency. You would then also, during that initial award phase, actually begin to implement that budget and start allocating your resources according to the guidance of that funding. Next slide, please. And then finally, during the post-award phase, this is where the work really happens. So as you all, as grantees, you would be actually implementing those project activities per the proposal that you submitted, the timelines with the budget, etc. You would complete those activities and again, make sure that you are conforming and kind of aligning to all of the terms and conditions of that award. And at regular intervals that would be specified again within those terms and conditions, you would be preparing and submitting progress reporting, financial reporting, and responding to other potential requests from the awarding agency. In the post-award phase, the awarding agency, and this is where you really see that difference between a grant or a cooperative agreement. the awarding agency is really just there to monitor progress, expenditures, etc. And with a cooperative agreement, maybe providing that more substantive involvement or technical assistance. They would also, depending on the award, might receive audit requests or comply with other tasks and things relating to analyzing the policies, etc. Sometimes that includes requests from Congress to say, hey, we know that we just appropriated new funds for these new activities. Let's see what you all have been doing with it, and really kind of reviewing those reports to ensure compliance. Next slide. All right. Now, we want to talk a little bit about kind of staying on mission while you're looking at grant fit and alignment. I think one of the most important things you all can do when you're thinking about grants and when you're looking at these new funding opportunities is making sure that the things that you're pursuing are really well suited to your organization's missions, goals, and needs. Next slide. So the first thing to do is really to understand that mission alignment. And what this comes down to are these funds being made available, and are they in alignment with the things that your community needs and the goals that you have as the grantee? It's also important kind of within this phase to think about and identify who are those potential partners that could enhance your project, and really, whether it's through a letter of support or even through other partnership agreements, actually help you execute these items. So here's some questions that you all could use to ask yourself at this phase. It's things like, again, is this addressing the specific needs faced by my community, faced by my stakeholders? Do the funding priorities, explicitly state or indicate compatibility with our subject matter and our mission? And are there kind of specific things around the populations that this funding is intended to serve, or other things that we'd like to address? All right, next slide. I think another really important thing to think about, and could talk a lot about this, is around the administrative burden that can sometimes come with these funding. So this is where it's really important to be reviewing those terms and conditions, the reporting requirements, the expected activities, to really understand, not only could we use this funding effectively in our communities, but do we have the capacity to meet the requirements and to meet the kind of financial obligations, the reporting obligations, and the other terms and conditions of these funding. This can be things like, what does it look like for us to actually be able to submit within that 30 or 60 days of an application? How will we be maintaining those lines of communication with the awarding agency? And what does that reporting criteria look like? Do we have the capacity to be maybe pulling together fairly significant reports on a quarterly basis, if on an annual basis? Every award is different and can have different terms and conditions. And so it's really important to understand the specifics and the timing implications. And in particular, think about things like, are all of our awards on a similar cycle? And so would we be doing a lot of the same types of reporting all at the same time? Like that can be a pretty significant burden. Right. Thanks, Amber. And then finally, the award and duration reasonableness, excuse me. So the first is the potential amount of this funding sufficient to implement the activities that we're suggesting or that we'd like to do? Is the duration of the award reasonable enough to measure impact? Typically, especially in the federal context, awards are 3 to 5 years in length. However, they would have individual, budget periods annually. And then finally, what would it look like if there were those unanticipated delays in funding? What would that mean for our implementation? What would that also mean for us in our sustainability as an organization? And this is, again, where it really comes back to, and why I spent some time kind of walking through how funds are apportioned and kind of appropriated. It's important to recognize that even if programs, again, want to continue funding, there are circumstances outside of their control. And so it's important to kind of understand those cycles and, where you all might kind of run into those roadblocks. And then finally, determining programmatic feasibility. So is the community ready for this initiative, for this new funding, for these activities? How will you all evaluate the impact and effectiveness? Not just based on the terms and conditions and the progress reporting that is being requested by the awarding agency, but how will you all know that this funding was used and made a difference in your communities? This is another, great opportunity to understand if there's any reporting requirements that might even continue after the funding has been spent. Some programs, ask for progress reports moving forward and really want to understand that impact over time, even if there's potentially no longer funding available. And then I think always important, consider how will the project be sustained after that grant period ends. Are there ways to either, bolster your own capacity, find other funding sources, or even just understand, what would it look like to move us from where we are now to where we might be in 3 to 5 years? And what does that forward trajectory look like long term?
Great, thanks so much, Sarah. So we definitely just had a great conversation about grant fit and alignment and some of the considerations that you should consider. So we'd love for you to enter in the chat, what type of criteria does your local health department use to evaluate whether a funding opportunity aligns with your mission and strategic goals? Feel free to enter in the chat. We'd love to hear from you. Great. Do you consider the administrative burden or the programmatic feasibility? Do you look at eligibility criteria first before moving forward? Yep. Staff capacity definitely is important. We're thinking about if you're able to apply for the grants, be able to sustain the project through the project duration. What else? Lila says, I look at burden moving forward. Yes. Lisa says sustainability. It's very important. We're going to be able to sustain the work. It says deliverables that we can meet in the time frame. Yes, that's very important. Making sure that you can actually complete all of the things that are required for the grant and within the time frame that you're given. Okay, continue to share. Thanks so much, everyone. We will go ahead and keep moving with grant application promising practices.
All right, so want to spend a little bit of time on just a few promising practices and really focused on, again, that grant application piece right now. So there's a lot here. I'm going to kind of run through some of them quickly and highlight a couple that I think are really important. I think the first is assembling the team. Grant applications, I know that you all know this, having replied to some and already having a lot of funding, they can be really labor intensive. They can require a big team, a lot of coordination, a lot of collaboration. And so I think outlining, first and foremost, who's on point for what section, how are we going to work together, how is this going to get completed is really, really important. What is it going to look like to do that review and approval process? Have we understood who all needs to sign off, who we should all be kind of connecting with and getting input from along the way? Establishing that regular review cadence. So, instead of maybe doing one final big review, hopefully more than 24 hours out from submission, what does it look like to check in regularly along the way and really understand, okay, how are we making progress? Are we having any roadblocks, any struggles, etc.? And making sure that your timelines and things are able to really be supportive of meeting those deadlines. One thing I want to highlight here, and especially as you're thinking about that review and if you have questions, etc., is that as a best practice, federal awarding agencies and even state awarding agencies will typically hold things like office hours, question and answer sessions, etc. when applications and kind of when funding opportunity announcements are out the door. Those are incredible opportunities for members of your team to join and ask direct questions, to understand the expectations, and frankly, to get clarity sometimes. And ensuring that, again, the way that you all are aligning your time and attention is matches with what the awarding agency is expecting to see in that application. So using those tools and resources, again, including ones like that might be available by the awarding agency, streamlining that information gathering. I know grant applications typically require a lot of information from a lot of sources. You know, how is that going to be collected, summarized? Who's on point for that? And, you know, what are the things that you can pull from that you might already have available that you don't need to redo, that maybe you've even used for other applications or for other reporting? Again, you know, what information can you use from those previous applications? And then have you also kind of really looked at your past successful projects, and are you able to really illustrate and highlight how impactful you've been with previous funding? Right. Here's a few more, because I know there's a lot. So again, a lot of these we talked about a little bit already, but just to kind of double click on. So again, have we understood clearly the objectives for this funding? And have we been able to articulate how our project will meet those grants, you know, objectives and goals? I think one thing and it's maybe a little bit of a silly analogy, but I always like to think of it this way, is that, you know, funding opportunity announcements and NOFOs are in some ways an open book test. They should be very explicit in terms of what they are looking for. And so you all should be able to understand very clearly, okay, if you know, the awarding agency is looking for X, how can we write to and speak to X? I think one of the biggest things that on the awarding side, sometimes folks see is that there might be a lot of great information about the efficacy of your programs and all the wonderful work you're doing. But if it doesn't align with the objectives of the grant, it can be difficult for the awarding agency to understand and really appreciate what you will do with that specific funding. Again, you know, looking at things like those needs assessment, assessing the alignment with your existing initiatives, you know, how is this either in support of things that we are already doing, or would this be net new? Would we potentially need more staff or other sort of different things that we would need to realign ourselves in order to take advantage of this new funding? Again, what are those performance measures? I think this can, again, be a very administratively burdensome activity sometimes for grantees. So if we understand, excuse me, within those terms and conditions, what we will be evaluated on as the grantee, you know, how are we going to be able to collect that data and report on that data? Are those things that maybe we already collect? And so no worries, we have that information readily available. Maybe it's, you know, just shifting a little bit how we talk about it, but not a new data collection. Or is it something that we would need to go out and do new data collection around? Again, you know, what are those guidelines? How are we really including that, you know, we've kind of addressed everything? Do we follow the required format? It's genuinely heartbreaking, but I have seen scenarios in which if an application does not follow the prescribed format, and typically, or sometimes they even come with templates, oftentimes they are not reviewed. You know, it's considered as being non-compliant. And so sort of the perspective sometimes of an awarding agency might be, okay, well, if it's not compliant in the format, you know, let's just put it aside and go to the next application, and never want that to be the case for you all. Have we, again, developed that sustainability plan? Have we talked about what this might mean for us if we get this funding and then it ends in 3 or 5 years? How are we really building towards that future? And then finally, you know, looking at, have we done that final review for content accuracy, quality? You know, again, have we answered all of those questions? Have we done it in the right format? Are we putting our best foot forward in order to have the best opportunity to secure this funding moving forward? And with that, I'm excited to turn it over to Julie.
Hi, everyone. I just want to check that you can hear me okay. Excellent. I apologize for joining a little bit late. I had a doctor's appointment that went even later than the later that I thought it could run. But my name is Julie. I work at NACCHO. I'm a senior program analyst with our HIV, viral hepatitis, harm reduction, STI, refugee, immigrant, and migrant health team. We're a bit of a catch-all syndemics team, but I think we like it that way, and getting to kind of weave in and out of different topics in there. So I'm going to talk today about opioid settlements, which can be very, very dense. Also, if you read any news headlines this morning, you will see that there is a big decision that was made by the US Supreme Court regarding one particular lawsuit in here. And so we'll get to talk about that a bit. And yeah, just really excited to jump into this with y'all. So I'm going to do, there's like a whole lot of information on these slides, and I'm going to very, very quickly go over the first 10 or so, but you are able to look back at these if you'd like, to be able to look at this. The big takeaway for this is that opioid settlements are incredibly complicated, and they are the most complex civil litigation in US history. Some of the lawsuits have been settled and some are currently still in courts. This looks at two kind of major classes of damages with this. So those kind of backward looking costs or compensatory damages, and then looking forward costs or abatement costs. Those are what is incurred by in the future in order to remedy the opioid epidemic or the overdose crisis itself. And then the backward looking costs are those that were incurred as a result of inappropriate prescribing and negligent distribution. Next slide. So this is just, again, to kind of reiterate, this is a very large lawsuit. This is a collection of over 3,300 state and local lawsuits against Big Pharma. That includes the opioid manufacturers, distributors, and retailers. We'll go into a little bit about who these folks are. This is a result of aggressive marketing, deceptive business practices, and lax monitoring of suspicious opioid orders. And that is all kind of what went into the lawsuits in the first place. Next slide. So a big thing to know as well about the opioid settlements is because those are with those 33 attorneys generals at state and local levels, there is not a great deal of oversight or really any oversight at this point at a congressional or federal level. Their transparency and accountability with these settlements, again, across all 50 states really varies and it's largely self-imposed. At the highest level, these lawsuits are only required to report use of funds not used for opioid abatement or remediation. They require oversight for those backward-looking like parts of the lawsuit, but not so much on the forward-looking part of it, which is a big lion's share of this. Public reporting is suggested, but it's not required. States differ in the reporting and transparency for their state and local funds. And states have different rationales for how they do that and why they do that. Next slide. So again, to just reiterate, all 50 states, including Washington, D.C., are receiving some settlement money in some form. This pot exceeds over $50 billion. So it's a very, very large lawsuit. And again, it involves a lot of folks in this. And we can move to the next slide. So we are entering into what would, yes, these slides will definitely be shared. We are in what's considered to kind of be the first wave of opioid settlements. This is the biggest wave of settlements. So again, we're looking at like around $50 billion that will be going out to state and local governments. The first wave of this is really front loaded. So a lot of those funds are starting to go out now. So last year, this year are really the first years that we're seeing big amounts of money of the opioid settlements go into place. In 2021, 2022 were really the years where a lot of attorneys generals, a lot of states and localities were really kind of laying the land for what these the disbursement of funds would look like. And now we're seeing those funds starting to flow out. If you are at a health department who has not really gotten this or still very much behind on this, don't worry. A lot of states have not actually been able to roll out those funds yet, but a lot of the groundwork has begun to be laid on that. So, and Mary Louise, we'll get to the questions at like a bit after this, but yeah, that's a very good one. So a lot of this money again is front loaded, this first $26 billion, which is so much money. So meaning again, this will go out, and we'll see kind of like the largest peak of it in these, now to about 5 years from now, and we'll see it kind of tapering off over the next 18 years. There's a second wave of funds. These are funds that went out that were signed in May of last year. That includes Walgreens, Walmart, CVS, et cetera. And those funds will start to be going out as well. There's still some additional settlements that have been pending. So Purdue, which we'll talk about in just a second, was there's been a major development on that at the Supreme Court level just today, as well as consulting firm McKinsey. Some states are looking at independent strategies for settlements as well. So there's, again, the most complex civil litigation in US history for a good reason. Like, it's just really, really complex. Next slide. So just a bit of a timeline here. So we see, again, starting in 2020, McGallicroth, which I should really look into how to pronounce that name officially. They were a manufacturer of generic opioids. They originally agreed to a $1.7 billion payout as a result of their bankruptcy. And then there were suits that followed, as well as people who were directly affected by the crisis. But the company filed a second bankruptcy in August of 2023, and it slashed $1 billion from that. So we've seen, again, there's just this huge, as these settlements have moved forward, there's also been a lot of back and forth with what that money flow is actually getting out the door there. Big developments in August 2023. So Purdue settled initially on, I think, around $6 billion of settlements to go out. A part of the settlement that Purdue agreed to is that it would protect the Sackler family who owned Purdue Pharma. Purdue filed for bankruptcy, but the Sacklers did not. But it shielded the Sackler family from any suits against them. The Biden administration, as well as many advocates in the opioid settlement space, were basically like, that's not good. We want to be able to go after their individual wealth, as they saw that, from their perspective, they profited from this very directly, and they were pulling money out while, situating Purdue, getting ready for it to go into bankruptcy. That went to before the Supreme Court back in December, and it said, later this summer, they'd be making a ruling. Well, today was later that summer, this summer. So today, this morning, the Supreme Court put out a ruling, essentially saying that this suit could not go through. So on one hand, that means that $6 billion that are not going to be going out right now. But it also says that that is because the Sackler family can be held liable, and should not have that be shielded from that level of protection in these lawsuits. All that to say, there will be a lot more to come. I think some people were like, oh my gosh, this means that all of opioid settlements are jeopardized. This is a small amount of money. I mean, $6 million is not a small amount of money, but in the grand scheme of how much money is going out in these settlements, again, $45 billion plus at this point will not be impacted by this settlement, or this Supreme Court judgment here. And we can go to the next slide. So many states, again, have now started dispensing their settlement funds. There is not any uniformity in how the states are reporting this. 16 states have promised to publicly report spending. 15 states have not committed to doing that, and other states are promising somewhere in between. So there's a whole lot of discrepancy in that. And that can be really important for y'all at local health departments to be able to see how this funding is being spent, both to understand what the priorities are of your health department, but also just for that transparency's sake, for the sake of being able to go back to your communities and talk about the ways that those funds are being spent and settled, or being distributed in your community as well. Next slide. So again, there's have been some back and forth about what federal oversight could look like. There were some lawsuits. The lawmakers raised concerns about this in the fall of last year. And essentially the Office of National Drug Control Policy stated that there is currently no mechanism that that could require states to disclose what the spending looks like. And then the next slide. One of the reasons that we think about this aspect of this a lot is because the way that these lawsuits really came down were trying to take these lessons learned from big tobacco. So if y'all remember, in 1998, there was a major lawsuit against like major tobacco manufacturers. There were, I remember pretty viscerally like being younger and seeing people going on, in front of like Senate and congressional hearings who had to use like a vocoder to be able to speak. It was very moving, very intense. And there was a very, very large settlement at the end of this. It was over $200 billion. Unfortunately, most of that money went to everything but that future remediation and tobacco cessation and tobacco prevention. A lot of this money went to go fill budget gaps. It went to building roads or other purposes. Very little of it actually ended up going to public health and to evidence-based services that would actually support people, reduce people's risk of developing cancers, reduce protecting people from secondhand smoke, helping treat those who already were addicted to nicotine, and protecting others from becoming cigarette users. So there were a lot of things that were done to try to put some guardrails in place. And we'll go to the next slide. So one of the protections on that is that at least 70% of those national settlements had to be spent on future opioid remediation. Again, that's those forward-looking amounts. Of that, so that remaining 30% that's there, that can be used for opioid-related reimbursement, administrative expenses, again, that backward-looking amount. And then 15% of that could be used for non-opioid remediation expenses. So that would be kind of the administrative costs related to that part of it. So private law firms, et cetera. So 70% of this has to go towards future remediation. And that's important for y'all because you were a part of that future remediation. And we'll go to the next slide. So in the national, like the kind of what we sometimes call the master settlement, which is that very first settlement that was reached, that really is kind of a blueprint for many of the ways that the states and localities kind of framed their suits. There's what we call these core strategies, or that are part of Exhibit E. Again, that's only specific to the national settlement, but a lot of other settlements have adopted these core strategies as well. And this is some stuff that you might be pretty familiar with that maybe your health departments are already involved in. So that's naloxone, which is a medication that can be used to reverse an opioid overdose, medication-assisted treatment such as buprenorphine or methadone, services specifically for pregnant and postpartum people. So thinking about those folks as being particularly vulnerable, not just that the fetus that they're carrying is vulnerable, but also that they're a population who have been disproportionately impacted and disproportionately impacted by fatal overdose as well, and particularly in that early postpartum period. Expanding treatment for neonatal abstinence syndrome, expansion of warm handoff programs and recovery services, treatment for incarcerated populations, prevention programs, expanding syringe services programs. So the harm reduction services that are out there. And again, evidence-based data collection and research to analyze the effectiveness of the abatement strategies within the state. So this is a part of the Schedule A, and we'll go to the next slide for Schedule B. Schedule B approved uses, we have treatment, prevention, and other strategies. Again, MAT, or what sometimes is called MOUD, medication for opioid use disorders, that are approved by the FDA, supporting people, connections to care, preventing overprescribing, misuse of opioids, other harms associated with that. And this is another big one, expanding access to testing and treatment for infectious diseases such as HIV and Hep C, resulting from intravenous opioid use, as well as other strategies like supporting first responders, leadership, planning, coordination, training, research. All of these are a part of this big, again, Exhibit E and the national settlements. And a lot of them have been adopted by the other settlements that are out there. Next slide. So I'm going to talk a little bit about, because again, this varies a lot state to state, but we're going to go through a couple of the models of how states are kind of doing the structured and spending plans that they have. And we'll go to the next slide. So in many states, the way that they're doing this is at 70%, it goes towards that future opioid remediation. This is often, it can be a set aside fund that can be done with advisors. There can be a granting process, which y'all have been talking a lot about those grants. Opioid remediation, 15% of that to be set aside for that. This is often sent to counties and municipalities. And then 15% for the non-opioid remediation. So again, legal slush funds or legal fees, slush funds, et cetera, could be spent on non-opioid use, but this small portion is the amount that has to be reported on. Percentages of this can be slightly different. Their breakdowns and set-asides can be different. We'll go to the next slide and see another example of how states are doing this. Some are giving like 50% to the states or to a special fund. There's a lot of different mechanisms. So some states have it so that there is a separate trust or fund that a large percentage of the money goes into, and that there's a competitive bid or application process for those funds. There are other states where there is a lot of state congressional control over that. And then other states who have their own funky little process for it. States do it pretty differently, but don't worry, there's really great resources for y'all to be able to look into how your states are doing this and how you are able to kind of see what those funds are and how you can start thinking about applying for those funds and what would be best to support your communities where you're at. And we'll move to the next slide. Some states also set aside a portion for special projects. So in Colorado, about 10% is going to infrastructure. Louisiana has sent 20% to the sheriff's office. Mississippi has given a good sizable amount of money to the University Medical Center. And then there are also regional projects. So in Virginia, where I'm at, there is our abatement fund largely does go to support regional approaches to opioid settlement spending. And that's a big priority of theirs. And we'll move to the next slide. I kind of touched on this earlier. So there's a lot of different ways that this money can break down: statutory trust, allocation statutes. This will be done through like, state legislatures. That can be really, again, depending on how contentious your state legislature is, that can be really difficult. A lot of states have chosen to do some type of fund. Some states are doing MOUs, so contracts between state and local governments that articulate those spending goals and then avoid that need for that legislative politics that could be at play there. And we'll move to the next slide. So this is, I think, the crux of what we're wanting to kind of get at here, and what we're trying to understand is how can you find out what's going on with your state? So there are fortunately a number of different resources that have emerged out of this. A really incredible one that's kind of been looking at this from the jump is opioidsettlementtracker.com. It was started by an attorney named Christine Minhee, whose early interest in big tobacco settlements really led her to just kind of have this incredible deep dive and really following all of the opioid settlements and just doing an amazing job with that. From that, she's worked really closely with Vital Strategies to do these state level guides for community advocates. And really, really comprehensive, really great. And I think are a really great place for y'all to go to find out more about your states. And I'm going to show in a second, like what those look like. NACCHO has done a bit of work around this as well. Last year, we did a webinar series on opioid settlements, as well as developed a very kind of quick and dirty how-to guide to understand opioid settlements. And so I encourage y'all to look through that and just to get some ideas of how to start tapping into opioid settlements in your area. If you're in an Appalachian state, so those states, really on the eastern seaboard with, everywhere from Georgia all the way up to, I think, Massachusetts even, the community education group is tracking very closely opioid remediations in those states, and you can get onto their listserv and get a wealth of information on a regular basis from that. And we'll go to the next slide. So this is a breakdown of the opioid settlements state to state. Again, you can see there's just a whole lot of different settlements that go into play there. This is from the Opioid Settlement Tracker website. And if you are on the website, you can kind of look around to see what your state is receiving and from whom. And then you can also get more details about where the spending is at on that. And we'll go to the next slide. And these are a few examples from the Vital Strategies work that was done with opioid settlement. There are these state-by-state guides. There's a whole lot more information than just this, but I wanted to kind of give just a screenshot of a few of these. So looking at Tennessee, they have more of that kind of classic model where 70% of this has gone to an opioid abatement fund, 15% of that to state funds, and another 15% to that subdivision fund there. And you can look and see how all the funds are kind of flowing through that as well. And then the next slide shows Ohio, which does it a little bit differently. So they have actually put their money into what's called One Ohio Recovery Fund or Foundation, who are controlling the funds of that portion of it. And then 30% are going directly to local governments, and then 15% are staying with states. So you may be in your health department getting some money already from opioid settlement funds, but it's not through a competitive process. It might just be money that's already been allocated that you're going to be getting to do what to work with there. And then that other percentage of those funds, that foundation fund there, is typically going to be funds that you will go through a competitive process or at least an application process in order to access those funds to those opioid remediation funds. Ohio is really interesting because they also don't have a great level of oversight. And there was a suit that was brought up, or was it a lawsuit, or was it they tried to pass legislation saying that there needed to be, oh no, it was a lawsuit that there needed to be greater transparency from One Ohio around opioid settlements. And then the state legislature passed a law shortly thereafter saying, no, they don't need to do that. So there's a whole lot of back and forth there. And it's all very interesting, but again, every state does this a little bit differently, or sometimes a lot of it differently. Next slide. So other things that I think are really important for us to think about when we're talking about like, okay, so your health department or maybe a coalition that you're working with, maybe you have an overdose response committee that you're working with. Maybe you are working with harm reduction programs. Maybe you're wanting to explore harm reduction or have a more equitable way of approaching overdose prevention in your community. Equity considerations for local health departments. Opioid settlement funds was put out last year through NACCHO in partnership with the Legal Action Committee and our Legal Action Council. And they did a really amazing job with thinking about prioritizing folks who are most disproportionately impacted by overdoses to your community. Again, really, really, really wanting to emphasize supporting evidence-based resources like harm reduction, MOUD, and non-coercive care options. Through all these opioid settlements, there have been a lot of like, snake oil salesmen and folks who are who have been very opportunistic and wanting to kind of, hey, we have this brand new product and it can detect X, Y, and Z, or it can do this. And a lot of them are not supported by evidence. They're very new and they don't have a lot of that grounding there. So it's really, really important to talk to those experts, talk to those folks who know, who's often going to be your health departments, and really looking at the evidence base for those big purchases, what you're doing, if that is the best sort of like use of your money, talking directly to people who use drugs and people who have survived overdose, people who've been most just disproportionately impacted by this, and really asking them, what are your priorities? What are the things that keep you safe and healthy? Leverage those community partnerships, think broadly about the services that keep people safe and supported. One thing that we hear time and time again is housing. Housing is huge. Housing is a huge part of people being able to navigate their substance use as well as reduce their risk of overdose. Food, accessible medical and mental health care. Those are all priorities that we hear directly from community members. Next slide. John Hopkins has also kind of created these principles for use of funds. That's a really great resource as well. So their 5 priorities really are, spend money to save lives, use evidence-based spending guides, invest in youth prevention, focus on racial equity, and develop a transparent, inclusive decision-making process. And we can move to the next slide. And all of the links for everything that's in there, when they send out the PowerPoint, I have links to everything that are in the notes section for each of those. So you'll be able to see those links individually there. And I did see there were a number of things that came up in the chat there.
Yes, there were. And so I can go ahead and start reading a few things off. One question we had was, how do we know if we will be getting more than one settlement disbursement?
Yeah, the best way for you to do that is to look at those guides that Vital Strategies and Opioid Settlement Tracker have put out. They also will typically link. A lot of states at this point have are starting to develop like some kind of listserv. Some of them can be more transparent than others. Some of them can be pretty like not so hot. Some of the states that are doing a really great job are like North Carolina, I think is kind of considered like a gold standard of transparency at this point around opioid settlements, Colorado as well. But for other states, you might have to do a bit more digging. But I would start with looking at opioid settlement tracker, looking at those state-by-state guides that they made with that were made with Vital Strategies, starting to come through there and starting to look through at least finding out how those funds are coming down.
Yeah. Definitely. I think we had like a similar question in Missouri about regarding Sullivan County Commission. They gave them $449 for naloxone dispenser, but gave the remainder to the hospital. So any thoughts on just like how they're allocating funds per state, per county?
I wish there were more thoughts. Again, I think there are a lot of ways that health departments can apply positive pressure on this, particularly around transparency, but also building those community connections and coalitions and talking directly to community members, hearing from people saying the things that we know keep us healthy and well are this, this, and this. And then the health department really being strong supporters of those evidence-based practices, those things that we know help people. So not just having naloxone at hospitals, but having naloxone in the hands of people who use drugs, making sure that as much as you're able to support harm reduction services. So not every state has syringe services available. But really, and maybe that's another place that you start and say, hey, we have the money now. Let's try this. There's over 40 years of evidence saying that harm reduction and syringe services is an effective evidence-based practice that reduces harm for people who use drugs, but does not increase crime, does not increase use, is not like enabling people who use drugs. So that's a really big way that I think health departments can play a role in this. Is really being those advocates for what do our communities need. When we think about rural communities, the challenges there can be so different. So having like a place-based, like syringe services program might not be the most effective way of doing that if you have people who are just scattered, or have longer distances between them, transportation challenges that are unique to like rural communities. So really thinking about what that looks like. Are there telehealth options that haven't been explored? Are there ways to just go physically meet people where they're at, and be able to utilize the funds to do that as well?
For that, please feel free to raise hands, come off mute, to ask any questions, enter them in the chat. We have a few more minutes for a few more questions if you have any related to the contents discussed today. Really, I'd love to know, just like, I know some of these funds are kind of like newly being dispersed and things like that. Any interesting projects that you've seen use these funds for things that you've heard of?
Yeah, I think there is a push. I want to say in Pennsylvania, in the Philadelphia area, to really be able to provide these funds for housing. And I thought that was just a really great initiative. Community spaces as well, and having like safer community spaces for people, and that's regardless of substance use. Some of the ones that are interesting and not necessarily a great way are, again, purchasing like technologies or equipment that have not been shown to be effective. So there are some really great drug checking tools that are out there, particularly like they're called FTIRs, which they're infrared spectrometers that do have a lot of great use, but they do require some training. They require ongoing maintenance, ongoing learning. It takes a while to be able to do that. But there are some folks out there who are saying, no, just get this one little gun and you point it at the, at the drugs and it tells you what's in there. And they don't, or they do, like if it's aspirin, so really looking into trying not to get too enraptured by like a brand new technology or a brand new thing, and making sure that you're doing due diligence when you are kind of being courted by some of these by these companies who are wanting to sell you something that might not be as effective as what they are, as what they're touting it to be.
Great, thank you. Questions for our presenters? Had a great conversation related to grant applications and as well as funding strategies. So Megan says, this relates to the first speaker, so that's Sarah. I'm new to public health and I'm wondering how others sustain programs after a grant cycle is over. Sarah, feel free to jump in and answer that question. And if those folks have things to share in the chat, please feel free to respond to Megan as well.
Yeah, so Megan, lots of different ways. So first and foremost, grant cycles, while they might be 3 to 5 years, oftentimes programs actually exist for much longer. And so while you might need to do a net new application for the next round of funding, in many instances, you'll actually programs will exist for decades. There's some HRSA programs, for example, that have existed for 50+ years and maintain funding, in that way. Another thing, and I would have plugged it earlier, at least for all federal grants, grants.gov is an incredible resource. It actually will show you what funding is available. It is where those funding opportunities are often posted. It also enables you to look historically and see what sorts of things have been funded by what agencies. Really recommend you all kind of take a look at those resources because it helps you understand what are the things that are being funded, at least by the federal government, and how could we start planning for the next time that this grant cycle might come into place. The other thing from a sustainability standpoint is that we're seeing a lot of push for, public-private partnerships. And so in particular, things like maybe the federal government or the state government is able to provide some funding, and then maybe those funds can be matched by an NGO or other donors. And there are some kind of innovative ways that I've seen funding sustainability done in that way, and can be a way of also maintaining some line to federal funds if you're also able to demonstrate that you're getting funding from other areas once you've built a bit of an evidence base and that impact base for what you've used the programmatic funding for.
Sarah. All right, well, thank you all for joining. I'm going to hand it over to Victoria to close this out.
Thank you, everyone. Thank you to our speakers. As a reminder, we do ask for you to complete the post-session feedback survey. I believe Amber will be dropping that in the chat, but we also email all our participants after with the link to the survey. As a reminder, we will be sharing today's recording, the optional participation guide that was sent to those who registered, and the slide deck will all be available on the NACCHO website, the rural health site. And Sarah also emails it out to everyone registered, but it will be on the website if you want to share it out with your teams. I see Amber dropped the survey in the chat, so please fill that out now while you have a moment. If not, thank you everyone so much for joining. This was a great Rural Cafe. Thank you once again to our speakers, and we'll see you guys at the